They say health is wealth. Worrisome, however, is that in spite of the globally recognized importance of this sector in Nigeria, the most populous nation and indeed largest economy in Africa, with its abundant human and material resources and large market, the health sector has remained seemingly neglected. It is even more disturbing that in the 21st century, when the rest of the world is strategizing and realigning for strong and sustainable economic expansion, the self-acclaimed giant of Africa is still battling with corruption, inadequate infrastructure, bad roads, among others. A focus on the healthcare sector today is a key player in the Health Maintenance Organization, the Managing Director of Healthcare International, in person of Mr. Tosin Awosika.
Greater awareness to the man on the street for him to be able to understand that it's better for him to have a health plan. Because some of the costs, in fact, most of the health plans cost considerably lower than what people spend on their recharge cards on a monthly basis. And that's the message we're trying to sell out to people, for them to understand that when you have a health plan, it makes it easier for you. You know, it takes away the pressure. Unfortunately, a lot of times you have a lot of people, like I said at the beginning, running into the hospital only when those conditions have become very critical. Some of those things are things that could have been taken care of much earlier if they had access to healthcare and if they had been visiting the hospitals. There are people who have lived with some conditions for several years because they have been able to, maintain themselves properly, that way. So we're trying to reach out to as many people as possible and get them to understand that having a health plan is supposed to be as important as maybe carrying your mobile phone. We want to intensify efforts along that line. We're one of the HMOs on the Lagos State Health Scheme, and that is kicking off about now. Right now we're doing road shows, so we expect to carry, we expect to carry the message out there to the public that yes, there's a need for them to have health insurance plans. If you look at 10 organizations that have health plans today, about 8 are practically forcing the scheme on their staff. Because yes, they've seen it as the most effective way of taking care of the health of their workers. I'm talking about the corporate entities. Most of them have seen it as, look, this is the most effective way in which we can get people to have access to good quality healthcare. But most people would rather not. Because in this environment, more emphasis is placed on curative rather than preventive. Tell most people to do health checks. They would rather not. It is when they fall ill that they want to run to the hospital. Most people would go to the hospital only when that situation is very critical. And that is why, more often than not, visits to the hospitals are near emergencies. And in the civilized world, most of the times when people go into the hospital, they are called emergency room. That's what we call, what is almost like routine to us is emergency in a lot of places. Because people, I can bet if you walk down the road, if you're supposed to have half a person, 9 persons out of 10 do not even know their vital health statistics, not to talk of having done some health checks and all of that. So that is the environment in which we're working in. So a greater number of the times, people going to the hospital are battling. And unfortunately too, In some cases, I'm not saying all, the providers are also not helping. Because yes, in a good number of times, when such people present in the hospitals and the providers want to treat, knowing that most of these people are under health plans and the like, they want to take maximum advantage. I mean, we've had to grapple with situations where, for instance, to find out whether someone's sugar level is high, a provider writes out about 6 tests, when maybe 1 or 2 could have given you the answer. Of course, they want to take maximum advantage. So those are the challenges that HMOs have to deal with. And because of that, a lot of people feel we're not doing as much as we could do. I know we can do better, but believe me, we're working in an environment which isn't very, very friendly. Look, let me say something. Let me give an example which I think will be easiest. One, we're called middlemen. A terminology I find very absurd, but good enough. Middlemen, because other than the NHIS, 100% of clients that visit hospitals have been sourced and marketed by HMOs. So please, where is the middleman? I am the one who has gone to look for these clients. I am passing them on to the hospital to receive care. That does not make me a middleman. The hospitals were there prior to my going to market these people. Why didn't the hospitals go there? Oftentimes, it starts with the HMO approaching the subscriber or the enrollee, who can be a company, a family, or an individual. We offer them our health plans, and they choose what is suitable for them. In the case of corporate entities, there are times when we actually have to, we call it customize, plans to suit whatever it is that they want to do. Now, when that is done, when they accept to come on the scheme, we go take them through a registration process. They choose a hospital, which is usually the first port of call for them. They choose a hospital, and after they choose the hospital, then we register them with the hospital. And when we register them with the hospital, then we move on from there, to pay what you call capitation. After they're registered, we pay capitation to them, to the hospital. Capitation is a predetermined amount of, is a predetermined sum, which we pay on behalf of the enrollees, and irrespective of whether they go to the hospital or not. The idea behind this is to create a pool of funds within the hospital environment, and that makes it easy for anybody makes it easy for the providers to be able to provide care, because of this, going by the statistics or going by whatever has been done prior to now, actuarial studies, barely 30% of any given figure, number of persons visits the hospital.